We know that there are really significant workplaces where transmission's occurring, the ones that we've listed previously, and they really are those essential sectors. So aged care, healthcare settings, meat works, large warehouse and distribution centres, food production, food distribution. That's where we're seeing numbers for sure. But of course there's a concern that there are other workplaces where maybe they're not so visible because they don't lead to explosive numbers of cases. We don't see outbreaks manifesting, or maybe they've got a very young workforce, mostly with mild illness, contributing to transmission but not necessarily showing up in the numbers or showing up in hospital because they're not as at risk of severe disease. So that's part of the deep dive that we're going to do, that we've always been doing, but that we're really looking into now, today and tomorrow. Clearly there's a concern that there's a broader cross-section of workplaces, transmission between workplaces and home and back again, that's contributing to the significant numbers. I should say, you know, it's dispiriting to see big numbers, and we all rise and fall with the numbers every day. The stage 3 restrictions had a really significant impact, and people should be gratified by the fact that that's the case. The effective reproduction number was probably, you know, at 1.75 or close to 2. It's come down to 1. But as the Premier said, we can't sit with 400, 500, 600 cases a day ongoing. We have to drive it down even further. And so that's part of the deep dive into the data to understand.
What's stopping you preempting? Because you didn't wait for a lot of data in other times. So why wait for the data this time?
Well, we've always looked at the data on a daily basis. We've seen modelling that suggested that we might tip over and have numbers reduce. But every day that we see numbers, every day that we see different settings and transmission occurring leads to a re-evaluation of how that's going. And obviously, when different cohorts of the population are affected, or it's spilling out into a different age group, a different geographical area, a different subsection of the population, that drives a different transmission. And so we have to review time and again. We've obviously had a number of interventions that have been very successful with the stage 3 restrictions. We've had other interventions that have come into play just in the last 2 weeks, including universal mask use, which has been modelled to have a really significant impact. That may or may not be playing out now. We've got increased workplace compliance. We've got increased oversight of cases and their close contacts. So all of those are new interventions that will show up in the data, but they're not necessarily there yet for today.
So for we laymen, can you explain over the next couple of days what will actually happen? A whole lot of people in one room, or just so give us paint a picture of what is actually going to be happening and who's going to be involved?
Yeah, it won't be a whole lot of people in one room. It'll be a whole lot of people on Microsoft Teams or Zoom or whatever, talking through those numbers. The detailed analysis really relates to who, where, how, why. And that's the age groups, the occupational groups, other demographic data in terms of country of origin or language spoken to understand where the transmission is concentrated, and to really explore those hypotheses of where transmission's occurring and what needs to happen in order to really suppress that transmission. And we've obviously had a lot of focus on those high-risk areas, and I'm sure that that's made a difference in those areas. But there's two questions. One is it enough? And two, are there other settings that we really need to explore in terms of making sure that people aren't in those workplaces infectious, or in those workplaces as close contacts, or potentially infectious developing illness?
Yesterday there were 500 or just over 500 healthcare workers affected, and today there's 1,030. Where are those healthcare workers, and is there enough protections for them?
I think I've said before, Andrew Wilson in Safe Care Victoria, our Chief Medical Officer, is looking into the healthcare worker infections. That work will probably be complete this week. We know it's a mix of aged care workforce, doctors and nurses in our acute care settings, but also many of the other ancillary workers in acute care. It's a huge concern to see healthcare workers developing illness. It is not always straightforward to understand how they've acquired their illness. We have to be open to the fact that personal protective equipment may or may not work in certain circumstances. It's been provided to everyone, but there's always a review of is it sufficient, is it being used properly, is it being used in all settings, in all circumstances where transmission might be occurring. I'm certainly not jumping to a conclusion that healthcare workers are only getting it outside of their workplace. That is not the case. Transmission is a risk within workplaces, but we do need to dig down to it to understand exactly how that's happening.
Last week you said there's no evidence that a stage 4 or a New Zealand style lockdown would work here. Do you still feel that way?
I think that's what we're exploring now. Obviously, a step up in restrictions is a really significant measure, but we are wanting it to be informed by evidence to the fullest extent possible. It gets to that point of being proportionate. There are, really significant consequences for what you do in terms of increased restrictions, and so it has to be focused on what the data tells us about where transmission might be occurring. It may be the case that an intervention in a certain area will make a difference. It may also be the case that we, look at restrictions in an area that are not a driver of transmission, and that would be an unfortunate impost and unfortunate consequences for everyone who might be involved there. So that's really what looking at the evidence, looking at the data is focused on.